Good morning to everybody. It's already past midnight here in Sydney, Australia. I'm delighted to be able to introduce TruScreen, an innovative AI-driven cervical cancer screening device. So please start the presentation. So as I mentioned, TruScreen Group Limited is a ASX and NZX2 stock exchange listed company, currently with headquarters in Australia. We've been in operation since 2014, but the actual technology, TruScreen cervical cancer screening device, has almost 30 years of history in developing it to a current stage. What you're looking at is so-called TruScreen 2 or Ultra device. It is an AI-driven, innovative, disruptive device that replaces the current cervical cancer screening system. We know cervical cancer is preventable. In fact, in last several years, revenue goes to support how important it is to implement novel screening solutions around the world. How does TruScreen work? TruScreen is a real-time operator independent, but non-healthcare dependent, not healthcare professional dependent screening device. It senses the tissue, reads the tissue using electrical and optical wavelengths, and it reads the tissue and delivers immediate results on the spot. The total examination time is about 10 minutes. In 2019, WHO has rolled out the strategy to eradicate cervical cancer on this planet by the end of the century, and TruScreen fits into one of the targets that have been signed up by over 150 countries. So how is TruScreen different to the conventional laboratory-based test? Well, first of all, it is non-healthcare professional dependent. We train people who can examine women. They need to be able to examine gynecologically, but beyond that, they just use the device and read the tissue. We are EC certified and ISO compliant device. We currently have presence in over 20 countries with different distributors. We're very interested to broaden our network of distributors. And in the next slide, you will see, obviously, the market size for us. It's massive. It's 50% of human population, with about 30% of females being in the screening age. So we're very confident that further outreach in terms of broadening our footprint will deliver excellent results. Our business model is through distributors. We run a very small, lean headquarters in Sydney, Australia. We hold the intellectual property. Production of device is in Sydney. Production of so-called single-use sensor that covers the wand is done out in China. And we certainly consider various types of partnerships with distributors around the world. This is my board of directors with 100 years of experience in running the companies. And on the next slide, you will see our executive group of managers who, together with me, we also represent about 100 years of combined medical device expertise, including R&D, commercial, financial, and medical affairs and market access. I guess there is maybe a little bit more on financials to present on the next slide. Before that, we also have medical advisors who advise us on continuous development of our device, including the AI algorithm, data collection, and just general functionality of our device. And on the next slide, you will see my international experts group who represent each continent, and the people who are here on the slide are pretty much an echelon of lower genitourinary oncological diseases, particularly with cervical screening expertise. In 2022, I am using a presentation that is based on financials of 2022 financial year for us, which has only finished roughly mid-year last year, calendar year. because our financial year is a little bit shifted. We have New Zealand financial year that finishes at the end of March. And in 2022, we have grown our revenue and quite significantly. We've rolled out new firmware. We've entered into Europe through operations in Central Eastern Europe, Poland, as well as pre-market in Serbia. And we certainly have advanced several clinical projects. I must mention that our clinical evaluations, total body of evidence is over 40,000 women. With the latest trials about 2 years ago coming out of China with 15,000 women. So we're very confident in our clinical data. We're also very confident in our financial results and in our growth. In 2022 financial year, we've written off some non-current assets that basically have enabled us to, if you like, to clean up our balance sheet. And in this financial year, I'm very pleased to say, although this has not yet been announced in our annual report, but I can say that we have weathered the COVID very well. So this slide is a repetitious slide just to anchor your thinking. Why would you choose TruScreen? It's because it's rapid, it's non-invasive, doesn't require tissue, it is fast, and essentially it is a non-healthcare professional dependent device. So thank you. Any questions?